Hello, everyone. I am really excited because we have the Dr. Yuli Chettipally here, and we are going to be discussing all things health tech. And this is definitely the person that we need to be chatting with because if you don't know, like he is the Innovator MD. So I am not gonna give you an introduction because I probably wouldn't do it justice. So I just want you to just let the people who are watching know a little bit about you and what you do.
Sure. Thank you, Akita, for giving me this opportunity to be on your show and to be able to interact with you and others that may be joining us. Um, so I'm a emergency physician. Started off my career at Kaiser Permanente. I also have an MPH in public health, epidemiology, population health. So that kind of gives me a bigger picture, broader picture of healthcare in general. That helped me, with my first job where I was on the administration track. I was the chairman of the department in South San Francisco, Kaiser Permanente for several years. And then mid-career, I switched gears and got into research because this was the time when electronic health records were fully implemented and we had collected quite a bit of data in the EHRs, but we were not using it for anything clinical or anything purposeful other than billing and stuff like that. So I got excited when I saw all that data and I jumped right into it and trying to figure out how can we use that data to help physicians make better decisions so that patients will get benefited from it. So I designed and developed and tested and implemented a clinical decision support system for emergency physicians where it is real-time guidance for physicians at the point of care. So for example, if you're seeing a patient with chest pain, it would tell you what are the chances of this person in front of you, what are the chances of this person having a heart attack in the next 7 days. So based on that, it'll tell you some suggested decisions that you have to make. For example, you can stop all testing because this person is very, very low risk on the spectrum. So they can send them home and follow up. So that system became very popular and successful, and it is still running in 21 hospitals in Northern California. And we developed several modules on top of that, congestive heart failure, atrial fibrillation, abdominal pain, head injury, and things like that. And so that became a very successful system. About 1 million patients go through the system every year. And we've published about 100 papers out of that work. That's when I got really interested in technology and how physicians think is different from how everybody else thinks about solving these problems in healthcare. So that's when I took early retirement from Kaiser Permanente and started this company called InnovatorMD. And the mission behind, or the idea behind InnovatorMD is that, physicians come up with physicians, nurses, pharmacists, anybody on the front lines of healthcare, they come up with unique solutions, but those solutions don't come to market. You don't see them in the market because it is so hard to bring a solution to market. Mainly because these physicians may not have the time, they may not have the resources, they may not have the network, nor there's a platform for that. So that's what I wanted to create, this community which supports them, which educates them, and also helps them bring their innovation to life. That's what Innovator MD does, and and that's what I've been doing for the last 5 years, and it's so exciting to see all these new things coming into play and getting into market.
That is just so much. And I just love you started and you had an idea and you implemented it, and now it's affecting millions of patients at Kaiser till this day, and all of the papers that have come out of it. And then you took it to the next step and you were like, well, if I'm thinking about these things, we need clinicians involved in the discovery of care. One thing that I would like to point out that I love to talk about is, you mentioned that physicians and other clinicians just think differently. And
Yeah.
I think that that's so important in the healthcare space, because we have a lot of startup organizations who may not necessarily be run by physicians or with clinicians in mind from the outset. And we have our healthcare organizations by different administrators. And I love to say that we think clinicians, physicians, through the scientific method, and we want to just have like a hypothesis and make sure it's right and test. And we have that curiosity, but we want to keep the patient safe. So we want to do it in that manner. And then a lot of the products that come forward use that design thinking method, where they're coming out with this idea, they want to prove it kind of similar to us, but then they want to do the lowest hanging fruit and like the most like basic of basic, and then test it to see what goes wrong and fix it. That part is a disconnect, because we don't want things to go wrong with human lives.
Yeah.
So what are your thoughts on that, and how do you think that clinicians think a little different, and how can that be an asset?
Yeah. Well, you hit all the right points, which is number one, clinicians are very knowledgeable in the scientific method and also the science of medicine, right? You have to understand science of medicine to be able to do any kind of innovation. Understanding the day-to-day challenges, right? Uh,
Mhm.
there may be a solution that is grand and beautiful and wonderful, but if it's not practical, you can't use it in a day-to-day life of a physician. And so physicians understand what can work and what will not work. Within 5 seconds, they can tell you, if this innovation is going to make a difference or not, because they are living and breathing, these solutions and problems all day long. The third thing is that, they have the grit, I should say, because going through medical school, going through training, going through subspecialty training, fellowship, and all of those things, it takes a long time and a lot of effort and a lot of focus to be able to accomplish that. That in itself is a very, um, very important skill for an innovator, for an entrepreneur, because you have to have that grit to be able to take this innovation to the next level, to the next level. And so those are some of the qualities that physicians and nurses and techs, they already have that. So you're just, instead of applying all those skills and all those important experiences, and take that, instead of using it for one patient at a time, you're using it for many patients at a time. That's the difference, right? Entrepreneurship is where you're affecting thousands and maybe millions of patients, but in your practice, you're working on one patient at a time. So it's the same principle, but you're expanding it, and obviously, there, physicians are very conscientious, because what they do makes a big difference. But also, if something gets messed up, also there is a big downside to it. So they are very careful in what they propose, and they are not these cowboys that want to go out there and and take big risks.
Mhm.
But they are very careful and they are conscientious and they are very hardworking, and they have the grit. That's what it takes, because it's a long, lonely road, innovation and entrepreneurship. So you have to have that um, long-term mentality to be able to bring something to market.
Absolutely. And you've been working in the with the community of creating some of these innovations. And like you mentioned, like there's that balance of innovating responsibly. Me personally, for those who may be watching, either here, and we're going to post it also on YouTube outside of LinkedIn. I've worked in health tech and all of the things for years, but I also am a healthcare risk manager. And it's not about like the saying the no's or being afraid, but it's about knowing the risk and figuring out what it's worth doing or what it's worth thinking outside of the box in a different way, because we shouldn't just be doing things the way we've always been doing them, but just online and calling that innovation.
Yeah.
So I know that a lot of the innovators you work with are coming up with some cool things. Do you can you recall any like fascinating innovations that have come out of your company?
Oh, many, many, many. So once we got the data that is coming from the EHRs,
Mm-hmm.
it's it's unbelievable how much of these nuggets are just sitting there to be discovered. A lot of information is sitting in our EHRs. Um, I'll give you an example, right? Like let's take type 2 diabetes.
Mm-hmm.
There are about, I would say, close to 70 drugs on the market for type 2 diabetes. How is one supposed to know which drug should they start this patient on that is coming there seeing them for the first time?
Mm-hmm.
Uh, and out of these 70 drugs, of course, we will use the ones that have always been used. We will always see what our colleagues are doing, and okay, these are the ones that we give priority for. And so we kind of go with the flow and do those things. But is it really the best drug for this specific patient X,
Mm-hmm.
right? If you look at the data, right now we have millions of patients, I don't know, 250, 300 million patients on EHR. So if you can aggregate that data and come up with, okay, which drugs will work for which types of patients? Let's say we take 30 or 50 characteristics of a patient and then figure out, okay, in these type of patients, in this group of patients, drug, you know, Y will work best in controlling this.
Mm-hmm.
So what is the downside? If you cannot find the right drug, which means that the time from you start treating to the time that glucose is under control will be months, if not years, before that patient. So during all this time, the risk for this patient for having bad outcomes increases because it's not being treated. Same thing with hypertension
Mm-hmm.
or cholesterol or any of these drugs that where you can actually change the trajectory of a disease process in the long run. And so what does that mean? If 50% of the patients are not being treated for their hypertension, that means there's that many more heart attacks and strokes and dementias and kidney failures. All of those things, they're just piling up because you were not able to identify these patients and be able to treat them with the correct drugs. And so that is where I think it can make a big difference in the whole healthcare system if you can identify those, predict and prescribe the right drugs. So I've seen a lot of innovations come through in that space. The other space where I feel very excited is that um, where you're taking a business process, and the business process has, let's say, 5 steps, and you're cutting that down to 2 steps. Of course, when there are 5 steps, there are other people in that business process, usually other companies or other, I call them rent seekers, you can, because just because they're in that process, they're collecting rent from the
Absolutely.
from the healthcare system. So imagine if you can eliminate two or three of those and you make the process direct. I'll give you an example. Um, there's this company, they make a system uh, uh, where you can dispense medications, prescription medicines,
Mm-hmm.
through a vending machine.
Mm-hmm.
So the physician writes a prescription, and it goes into the system, and the patient takes their ID card, and then they go to the machine, and the machine checks them out and delivers the drug, through the machine. Oh, how many steps have we eliminated there? And this machine is right in the doctor's waiting room. And so I am fascinated by those kinds of innovations where you're eliminating a lot of steps.
That
And
is amazing.
right?
Like when,
I mean,
when you think about it, because I've definitely I haven't heard of that being in a physician's office, but college campuses they have the birth control ones
yeah,
machines, or like where just anything. Like I've been seeing.
urgent cares, emergency department.
Yeah, it takes out that middleman and it allows people to get through those processes if they have issues
Yeah,
with getting it from the pharmacy, all of those kinds of things. And then
yeah,
even more so what you said earlier about like precision medicine, like it's such there is the art of medicine, but
yeah,
sometimes that art takes a long time as the patient's bodies are deteriorating. So if
yeah,
we could make it easier on the patient, easier on the whole process, easier on the system, my
exactly.
God, these are some exciting solutions.
And then the third area where I'm excited about is where some of these new technologies, where if you can put them together,
Mhm.
you can come up with a new solution that was not there before, that was not possible before.
Mhm.
For example, my current startup, it's called Sirica Therapeutics,
Mhm.
where we are designing a therapeutic device system for autism.
Mhm.
Now, it uses robotics, it uses video gaming, and it uses virtual reality. So these three items have existed in the past, but nobody has put them together
Mhm.
as a system, as a therapeutic system, where you are taking an experience and making it into a therapeutic experience for the individuals who don't have much treatments available other than drugs and ABA therapy, which is applied behavior therapy. Other than that, there's nothing else. So, creating these new opportunities using the newer technologies, putting them together in an interesting way, that actually propels some of the science and the developments R&D in these spaces where it's totally dry and nothing is happening.
I love that. And that's so innovative. Like, I do want to ask a little more about your organization in terms of like how can it be like revolutionary for families who may have people in their lives who are living with autism? Like how can it affect
Yeah, I mean, as you may know,
that?
autism is the fastest growing developmental disability there is, and it's only number two behind ADHD. 1 in 36 births will be diagnosed with autism, which means that it's been growing at a rate of about 8% every year for the last 20 years. So it's a huge problem right now. And the future, it's going to be even bigger problem because nobody has, well, there are researchers working on it day and night, but they haven't figured out what causes this, how do you predict it, how do you treat it, how do you cure it. There's no cure. This is a lifelong condition, and it's a huge strain on the family. And we have a daughter with autism, so that's why I'm so passionate about this topic, and I've really, did a lot of research trying
Mhm.
to figure out what is working and what is not. So what is not working is that as the kids get older, especially teenagers and adults, they become more difficult to manage. And when that happens, you see these aggressive behaviors and disruptive behaviors. And so the only way they can do it is, they have to give them medication to calm them down, which means that you're suppressing a lot of their activity, which means that they'll stay in their room and just sit there.
Mm.
They have no life. They cannot go out. They cannot have participate in social activities. And if they have to go out, they need one or two adults with them to manage them. And so it becomes a very, very difficult process. What if you create a system where you're taking them out in a virtual world,
Mhm.
but also giving them that physical exercise that comes with it? So it is a physical exercise challenge and a mental exercise challenge that stimulates your brain and stimulates neuroplasticity. And that's our hypothesis as we are working on this, creating this new treatment called cognitive sensory motor therapy. So it's fascinating on the, the potential of areas where you can go with the new technology is amazing, and that's
It
what
is
we're
so
thinking.
fascinating. Like, and obviously, you have a dear, your daughter living with autism, and just this year, two very close little ones to me were diagnosed, and like just seeing, like, even
Yeah.
at like the younger age, like 2 or 3, where the healthcare system isn't as
No.
good as we know it's broken. So like having people have to wait 8 months to even get a visit after diagnosis when intervention
Yeah.
should be earlier is very important. So perhaps this could be used in certain facilities or daycares or centers. So that's just fascinating.
Yeah. Yeah. And there are not enough therapists to be
Hmm.
able to, to be able to take care of the demand for services, and there are no drugs that'll take care of it, other than sedating and anti-anxiety, anti-depressant drugs, which are generic drugs that are used to treat adults with autism. But it's a very, very challenging area for parents, for schools, for the society in general, because it's a very expensive condition to manage.
That's so true. So I will be following along, and we'll probably have you back to talk more about those innovations and how they grow and evolve and the different use cases that you can use them for. Um, and we've talked a lot about like how you've been working to help facilitate change in the healthcare arena from your Kaiser days to working with Innovative MD to now this organization, and you even have a book called "Punish the Machine: The Promise of Artificial Intelligence in Healthcare," which is a fascinating title for me. For those who may be watching, y'all may have seen a lot of my videos recently have been about the hot topic in medicine, AI in healthcare, and we know that it's been around forever, but we're putting a focus on it and we're utilizing it in different ways. I would love for you to tell us about the book and more about what you were talking about in it.
Sure, sure. Well, the book came out, several years ago,
Mhm.
even before people were talking about AI in healthcare. But the premise is that our knowledge in medicine, the science of medicine, has been growing gradually, right?
Mhm.
And we consider, when we do research, we consider, the clinical trials, randomized, double-blind clinical trials as the gold standard, right? So we have a population, and there's a problem, and we pick a sample of that population and we study them, and then come up with these clinical trials to prove or disprove something. So we have this large population out of which we take this small population and study. Now we are at a phase where you can study the whole population. Imagine, it
Mhm.
was never possible before. Now you can study the whole population, and you can find some nuggets in there that are not, that we never knew was possible. Um, I'm trying to remember this paper. So they were looking at drugs that cause acute kidney failure. So we have our own list from medical school, from what we have learned, all those things were there. But they found 11 other drugs that can cause kidney failure. We never knew about it.
Mm-hmm.
I mean, maybe anecdotally, but we never considered those drugs as nephrotoxic.
Mm-hmm.
So those are the kinds of insights that one can get when you look at the big data and use AI tools to find those nuggets and be able to use to make people healthy. So that's number one.
Mm-hmm.
The second big deal is where you can predict a person's bad outcomes in the future. For example, we can say that, okay, this person will have a heart attack in the next 5 years. That's possible to do, or a
Right.
stroke, or whatever, right? So, if this person is going to have a heart attack 5 years from now, what are the things that you can do now to mitigate that destination or that outcome
Mm-hmm.
so that it will not happen? And so that is definitely possible now to be able to predict that. Um, and then changing the science of medicine. We do a lot of things in medicine that we're not really sure that they are actually contributing to a positive outcome. Sometimes they may even be contributing to a negative outcome, like these drugs that we never knew that can cause problems, right?
Mm-hmm.
Maybe some of the treatments that we are doing are not good in the long run. Maybe some of the procedures that we do, maybe that's not good in the long run. And so those kinds of insights you can get with AI tools. And
Mm-hmm.
that is maybe half of what we do is totally useless. And so trying to figure out which half is useful and which half is useless, that is a big deal. And that is what is possible with AI and big data.
I think there are so many potentials, and like you hit on some really good ones, like being able to predict these things utilizing analytics, being able to increase like the rate of clinical trials. Like things take so long to do, and like if we could look at this data and then on such a larger scale and be able to apply it in different ways, I think that that's amazing. And of course all of the other ways that AI could help with just helping even prevent burnout for physicians, or helping with the administrative tasks that people may not want to do.
Yeah.
There are some people who may be a little afraid of AI and they may think it's coming to take my jobs. But I think a lot of that is like education, number one, on how we can use it, how to use it responsibly, and then how to help people kind of optimize what they're doing. And I think that yes, the book is kind of one of the originators in the frame of thought. So, you guys, I'll put that in the comments after this. The link to the book, so that you can
Thank you.
learn a little bit more about it, and then figuring out how we're moving forward. So, with that being said, you have a pretty big conference coming up. Can you tell us about that?
Yes, yes. So every year at InnovatorMD, we do two big conferences, one in the winter and one in the summer. So in the summer, it's called InnovatorMD World Congress, and it's going to be on July 11th, 12th, and 13th. Um, and we bring in the top speakers that are there, top innovators, people, thinkers and doers, and that's what I call them, which are who are not really run of the mill, and these are people who are thinking beyond, out of the box, right? So we have Dr. Marty Macquarie from Johns Hopkins. We have Dr. Apurv Gupta. We have Dr. Castro, who is a pioneer in the Chat GPT area. Um, So some amazing speakers, and then 35 or 40 others. So it is
I
a
think you kind of
packed.
lowered the bar this year. You kind of let me slip through. So but
Oh,
no,
oh
it's
no, no.
then there's me. But
Yes,
it'll be a
Dr.
fun.
Akita is going to be there, because we want different voices, different solutions, different thinking to come together and say, hey, there's a different way of thinking, not your run of the mill. Of course, you can go to your society meetings and all that, but this is something that is good for any specialty,
Mhm.
and you'll be blown away with the ideas that people will bring to this conference. I really enjoy this conference because I learn a lot from all of these innovators, and there'll be startups, there'll be workshops on different things that you may be doing. So it's a very innovative and a different kind of conference that you will get a lot of enthusiasm and inspiration from, because there may be some ideas at the back of your head that have been lingering for a long time. And when you see these people that are actually implementing their own ideas and bringing it to life, you will get inspired. If nothing else, you'll feel that, oh, healthcare is in good hands, and these physicians are doing amazing things. So you'll feel good about it, good about your profession, and very optimistic about the changes that are coming through.
I can't wait to see everyone because it just seems like from the topics that are online that they're going to be such amazing topics that a lot of people have been dying to hear about. I like to call myself a conferenceaholic. Uh, Outside of just going to a bunch of them, I've been speaking at a bunch recently, and I will say that these headliners and the topics are so relevant and so great, and I think that we'll all take away some lessons from it.
Yeah,
So for those who may not have looked into it or heard about it, the good thing is it's virtual. I put
yeah,
the link online for you guys to follow, and if you go on Innovator MD's like LinkedIn or website, you'll be able to register as well.
yes, yes. And definitely, and I'm sure when you mention Dr. Akita's name, you'll get a discount also. So make sure you do that.
Absolutely. I'll put when I reshare this for those because I know some of you guys are transitioning from work or it may be the middle of the day where you guys are. So this will be available after we end because it's live and then we're gonna post it on LinkedIn. So when I mean on YouTube. So when I repost it, I'll put the link with the code on it.
Yeah,
But it was such a pleasure for you to join today. So I just appreciate you for coming and sharing all of your words of wisdom and all of your insight on all of the changes that are going on in healthcare technology. For those who are watching, you may be thinking, like, I'm not in a startup or I don't want to be an entrepreneur or an innovator. You kind of are because with the state of healthcare at this point, the hospitals are adopting technology. So every health system is a healthcare technology system.
yeah.
So it's great that you have this platform for people to learn from. And for those who are watching this newer series, we'll be continuing with wonderful people in health tech.
Great, great. I mean, this is a great service to our community that you're doing. And like I say, innovation is happening, right?
Mhm.
You either get on the bus or drive the bus, or otherwise you'll be run over by the bus. So you pick what you want to do. you
Absolutely. Yes. So, bye to all the listeners and be sure to share this with your colleagues. Bye.
Yes, thank you very much. Bye bye.